Good afternoon, guests. I am Bibeth Orteza, and I have the honor of being your moderator for today. On behalf of my breast sisters from the ICANSERVE Foundation, I welcome you all to the 6th Southeast Asian Breast Cancer Symposium. The next 3 days will be full of discussions, discoveries, and above all, hope. Hope that together we can all walk towards a better future for the global breast cancer community. I started my own walk 18 years ago. I am an 18-year-old breast cancer survivor. Just as a brief aside to our guests from other countries, this explains why my shoes do not match. My shoes do not match because when I was doing my 4th chemo, I got bored just staring at a pair of shoes that matched. And then I realized that if after my chemo I would have one real breast and one false breast, if black and white went together, if fat and thin were a pair, why can't I wear shoes that don't match? And so I would explain this every time I'd go on to our events. And then soon enough, with some sisters, it got to be a habit. One who was going through chemo for today, for this period, whose best friend was going abroad to work, but if they had the same style of shoes, she would get her best friend's left shoe from another color, and then the best friend would continue to wear her right shoe in another country. So in a way, there was still the connection, because we are all connected, even as we are not our breasts. And as we all know now, a breast cancer diagnosis is not a death sentence. So we now go on to a good start for the day. Let's hear 2 special messages from 2 of our strongest advocates. I am honored to welcome Her Royal Highness Princess Dina Mired and Department of Health Officer in Charge, Dr. Maria Rosario Vergeire.
Comesta kayong lahat. I would like to welcome all the cancer survivors, cancer advocates, health professionals, policymakers, researchers to the 6th Southeast Asian Breast Cancer Symposium hosted by the ICANSERVE Foundation in the Philippines. You all share a common goal of improving the lives of breast cancer patients. You are all imagining and engineering a better health ecosystem for your countries, but you're all at different starting points. For those ahead, please help those who need to get to where you are. You were once there and know what it's like. Share what you know to shorten the learning curve for them. Teach them, and one day you will be learning from them too. For those who have a long way to go, don't feel discouraged. Don't be afraid to ask for help. And be reminded that it is the baby steps that get you where you need to be. Every step forward is a move closer to the goal. That was our story with our very own National Jordan Breast Cancer Program. In 2006, we went from 80% of women presenting themselves at the late stages of the disease, stages 4 and 5, to today being able to halve this deadly statistic. We did it in baby steps too. When united, you can work better together to create solutions unique to your people. You can project a voice so the world sees you for who you really are. You should not be lumped into mindless, faceless categories. The world must realize the unique contribution you can share in terms of data, research, talent pool, patient profile, and innovation. You all have much to say and much to contribute. I admit not many are aware and knowledgeable about the diversity and uniqueness of the cancer experience in the ASEAN. I challenge you to make it known, but do it together so you can do it louder. As the mother of a child cancer survivor, I know what it's like to feel sick with worry for our precious ones. But I also know that cure rates, especially for breast cancer, have reached 80 to 90% plus, especially if detected early and treated qualitatively. Knowledge is power. Unity is power 2.0. Let's work hard, let's stay focused on the goal, and lift each other up so we can catch up with each other and get to the goal faster. And when we help each other, we will find ourselves with many friends at the finishing line. Friends who will sustain each other in the advocacy. Thank you so much for allowing me to join you at this conference by giving a short welcome note. I would have loved to be with you, but unfortunately you're much too far away from Jordan. Good luck at the conference, and thank you very much.
To our speakers from our neighboring countries in Southeast Asia and the United States, our various proactive civil society organizations, organizers of this symposium, health professionals, policymakers, and the champions of our shared cause, the breast cancer survivors. Good afternoon to all of you. The Department of Health would like to express its gratitude and appreciation to the organizers for holding this Southeast Asia Breast Cancer Symposium. Platforms like this are crucial as they provide us this opportunity to work together to improve access and quality of breast cancer services in the Philippines. In the Philippines, cancer is the third leading cause of death, and every year, over 150,000 new cancer cases are diagnosed, and many of these patients do not receive proper treatment. For breast cancer, 27,163 new cases were reported in 2020, making it the most common type of cancer in the country. As such, cancer remains one of the priority diseases of the age, and it is our priority to reduce the significant impact of cancer on our patients, their families, our communities, the health system, and society at large. Through the enactment of the National Integrated Cancer Control Act, we were able to initiate the necessary groundwork to improve cancer service delivery in our country. For instance, we have implemented programs that increase access to cancer medicines and provide treatment support. But there is a need to emphasize that the cancer elimination and prevention is not just a matter of improving healthcare services. It requires coordinated, multi-sectoral participation. As such, we implemented the settings-based approach to ensure the environments where we live, where we work, and where we play are supportive of practicing healthy behaviors, reducing the risk of developing cancers. Moreover, we continue to reorient our services towards primary care and to more preventive and health-promotive measures so individuals remain healthy. We have already seen significant improvements in survival after countries started to introduce early detection interventions that were coupled with accessible and affordable treatment. Many countries today have already demonstrated reducing breast cancer mortality by 2 to 4% per year. These successes were made possible by their working together, further driving the point that multi-sectoral partnership to strengthen cancer control initiatives in this country and Southeast Asia is even more crucial. In this light, may we continue strengthening our existing partnerships to ultimately eliminate cancer in the country. We recognize and appreciate the unwavering commitment of our partners in helping the DOH towards this end. Rest assured that the Department of Health we'll continue expanding our work on breast cancer elimination, strengthening healthcare systems by setting up standards on cancer screening services, developing mechanisms to expand access through availability of outreach services, providing cost-effective modalities and technologies, among many others. Together, let us all work together towards achieving a healthy Pilipinas.
Thank you very much, Her Royal Highness Dina Mired and the Department of Health, OIC, Dr. Vergeire. One thing that's very clear in both their messages is that it's a community that gets cancer. It's not just a person. When a person has cancer in a family, the family has cancer because everyone pitches in. We all need to be hand in hand together to go towards a curable disease. Let's not just be happy that, oh, there are cures for COVID. No. We pick up the fight. We continue the fight. And here now, I would like to introduce to you at this point someone whom I had first met when she was in first year high school. I met her in her high school uniform in the home of her grandparents. So please welcome our founder. She's going to make me emotional. Please welcome Cara Magsanoc-Alikpala.
Hi. This feels like a family reunion. Good morning, good afternoon, wherever you are from the Philippines. On behalf of the ICANSERVE Foundation, thank you for joining us. And for those here in the studio, it's so nice to see all of you. CBCS or SEABCS is back, kinda in person and not so in person. Thank you to our speakers and partners who flew to Manila. Let's give them a round of applause. We appreciate your support. Isabelle from France, everyone else from the U.S. and from Southeast Asia, thank you for coming. We accepted the invitation to host the 6th Southeast Asian Breast Cancer Symposium to be counted in the region as a member of the Coalition of the Willing. Thank you, Caroline, for the trust and support and for allowing me to nag you every day. We believe we can be more powerful if we collaborate with our neighbors. I've attended a lot of cancer conferences abroad, but this is where I felt most at home. We share the same culture, character, capacity, and challenges. Strategies and solutions we exchange can be more relatable and achievable. There's so much potential for us to grow our own voice so we have our own stamp in the global cancer arena. Many don't know which countries belong to Southeast Asia. We need to come together, define ourselves, and project our uniqueness. Our unique profile should be reflected in, say, biobanks, in the designing of research and clinical trials, and perhaps it would be good for clinicians, researchers to get equal billing in authorship in journal studies, or at the very least, to be acknowledged. We need to penetrate a lot of spaces. We have to speak louder so the world gets to know us, and we can help the future of cancer care. But strengthening the partnerships in the region is not enough. We need to go beyond our extended Southeast Asian family. We need the help of those with the data, the expertise, the wisdom, and funding, wherever they may be. Today, we have resource speakers from 14 countries participating in person and online. Thanks to all of you. We appreciate your time. We are ever so grateful and honored by your presence. We also thank the reactors and moderators who will enrich the conversation. We also want to thank the past hosts who generously share the resources and time helping plan this summit. Thank you, Rose Ton of Myanmar. Where are you, Rose? Please stand. Thanks, Rose. And who doesn't know Ranjit Kaur of Malaysia? Iriel Traisansri Imjai Chitaparanuks of Thailand, who can't be here with us today, and Linda Agum Gumelar of Indonesia. I thank her for all her help. But with us from Indonesia is Ning Wining. Thanks, Ning. The CBCS family keeps growing, and we are very proud to be part of this family. We also thank Ana Cabanes, Global Research and Advocacy Advisor. Where are you? And Dr. Rosel de Guzman, are you here? Chair of the ASCO's Asia Pacific Regional Council. Both of them helped us craft the program along with Carolyn. This is our 6th CBCS, and let's boldly say we are ready for a 3.0 kind of collaboration. Let's step on the gas. Let's work with what we have. In this room alone, your combined knowledge and expertise is mind-blowing. Everything big begins small. Just think of your own organizations and how far they've come. CBCS started in Hue, Vietnam with only 250 participants. Today, we have 1,900 plus registered participants. This was before noontime. A dream realized by 3 people, Carolyn Taylor of Global Focus. Carolyn. Dr. Cheng Har Yip of the International Surgical Society. Thank you for thinking of this. And Dr. Nguyen Din Tong of Hue Central Hospital. From 1 summit in Vietnam, we now have 6 and a lot more partners. On the last day, we have a session called Louder Together, calling all ASEAN voices. No PowerPoints, no video, no fancy graphics. Good old-fashioned brainstorming about how we can work together as a region and with people outside our region. If you have any suggestions on how the region can collaborate, please send your suggestions over. We can take inspiration on what has been started. We can look into non-cancer spaces for ideas too. We have to get very creative. That's why we have design thinking-driven sessions this weekend to stretch our imagination about possibilities like sessions on advanced technologies and artificial intelligence in healthcare and unlocking patient power. It's no coincidence that our speakers in these sessions are very young. The youngest one is not even 20 years old. We too can think like them only if we banish our biases, barriers, and the fear of making a fool out of ourselves. And one thing I'm looking forward to is Dr. Nirmala's presentation about measuring happiness. She said, why do we always measure suffering? Because 0 suffering doesn't mean you're well. So she's doing it the other way around. Again, thinking out of the box. For the region, we can explore mentoring. Dr. Chris and his wife, Finola Chatamra, founders of the Queen City Kid Center for Breast Cancer, are funding a partnership with the Ministry of Health of Bhutan. Beginning this year, they sponsored 6 medical practitioners doing their postgraduate studies in their hospital in Thailand. Training is focused on surgery and radiation. These scholars say they're very grateful and have learned a lot. The couple are also donating a 3D tomosynthesis machine and workstation to Bhutan. This involves training the technicians how to maintain the machines. I know ASCO, or the American Society of Clinical Oncology, has been doing mentoring in the region as well. In fact, before the pandemic, some of the CBCS events had this built into their summit. Mentoring has been happening longer than we know. Let's have a listing of all these so we can build on each other's projects and scale it up. We can also do more capacity-building virtual workshops and no longer be limited by the cost of airfare or accommodations. We can access any resource person, any trainee around the world. The ICANSERVE Foundation did just that last year when we launched Patient Power Philippines, a loose coalition or alliance of breast cancer patient groups. We brought together 30 groups from Metro Manila and 7 provinces. We have done 2 similar gatherings in the past, but budget constraints didn't allow us to bring everyone together. The pandemic Zoom craze solved that problem. We need funds to build data and digital infrastructures. Data today is the best friend of patient advocates. We need to invest to rebuild this into our existing and new programs. It grounds all our demands, our discussions, debates, and discussions. We can collaborate as a region to produce data, a position paper, if we want our profile represented in global platforms and discussions. We need more regional research. The action study of 2015 done for Southeast Asia was groundbreaking. It gave us a more detailed idea of how bad the situation was. We need more of this kind. It confirmed what we already suspected, that the cancer diagnosis in Southeast Asia is disastrous. The poor and patients with advanced cancer were common and particularly vulnerable to adverse economic outcomes and poor survival. The study also said there is a need for more resources to aid early detection as well as policies that improve access to care. It also mentions there is a need to remove financial barriers and provide adequate financial protection from the cost of illness. We clearly saw pain points and where intervention was needed the most. When we lobbied for the National Integrated Cancer Control Act in 2019, we quoted this study a lot. The Philippine section was called the PESO study. You will meet some of its authors tomorrow and hear their follow-ups on the action study. A few days ago, as if to tell me that the stars are aligning in our favor, I found out that the UICC Senior Manager, Lorenzo Bofi, just moved from Geneva to Manila. Not simply because his wife got a job here, but he also said that the UICC wants a stronger presence in Southeast Asia. This is a big deal for our region, and this is a big deal for the Philippines. The incidence in breast cancer is increasing at a speed that outpaces the gains and inroads all of us in this room make, and even for those who are watching. We need a revolution in cancer care in the way we think, imagine, and in the way we get things done. We cannot keep doing the same things that don't seem to work anymore if we are to overtake and to outsmart breast cancer. Thank you very much again. Thank you for joining us. Please stay with us for the next 3 days. God bless you all.
Thank you very much, Cara. And as she was talking and I was taking on everything that she said, I couldn't help but envy the fact that she could still, at her age, be able to wear something like that. Whereas I no longer can, okay? So, anyway, what a great way to start the weekend. Coming in from the week where most of the events in Manila had to do with remembering the declaration of martial law in the Philippines in 1972, we now move on to something more positive and something more hopeful. And I feel lucky to be here. Yes, lucky despite my having lost a breast. Because you guys more than make up for the absence of one breast. But as we talk now about these things, we also need to know, where are we exactly? Where do we stand in our present fight against breast cancer? Here now, please welcome, to give us the state of the ASEAN Regional Situationer on breast cancer, the current scenario, please welcome Isabelle Soerjomataram.
Hello everyone. So can I move around and you can still hear me? No? Okay. So my name is Isabelle Soerjomataram. I come from Lyon, France, but originally I'm Indonesian. I still feel Indonesian at heart. And then when I heard about this conference here, I immediately contacted, is it going to be in person? I would be very happy to come, because coming here I feel immediately at home, closer to Jakarta where my parents are, but also a lot of things closer in terms of culture, in terms of hospitality. People here are so nice and friendly. And in terms of food as well, of course, no? So what I'm going to present today are numbers, data, but still saying that I'm presenting numbers and data, please be reminded that this is not only numbers. Like Vivette said, it's also people, it's also families, it's also community at the end, and countries, people. So I'll present data that we have then from what we call cancer registries. Can I also click on this? Yeah. So the data that I get receive is data from what I call cancer registries. So the data is not coming only from one hospital, but it comes really from a whole region. And we have this data from different countries in the world. In countries like Asian countries, ASEAN countries, because it's so big, so we have data only from parts of the countries, but it gives you a lot of information already on what is happening in the region. So, and then when I'm doing this presentation, I'll do also a little bit, not only ASEAN, I'll start a bit of a global data just to show you where we are standing globally, okay? So, the first slide. So this is then the slides on where breast cancer is today. You see a lot of pink, that means that breast cancer. So this is then where breast cancer in every country stands. So where then the color is pink, it means breast cancer is the number first cancer in that country. Breast cancer is everywhere at the moment. If we're seeing there's 85 countries in the world, in 157, breast cancer is the number one cancer in that country. So imagine how many breast cancer sisters we have in the world, not only in Asian countries. And then if you see then only ASEAN countries which are then there, almost everywhere you see then pink color there. If you're seeing the number of people dying from breast cancer, it may not be as obvious or evident as what you saw before, but still you see a lot of pink colors everywhere. There are still too many people, too many women dying from breast cancer everywhere. As we heard before, survival at the moment is very good. There's still too much that you can see here. So 185 countries again. In 110 countries, breast cancer is the number one causes of death in that countries. Again, it's very important in a lot of ASEAN countries. We know how to early detect it. We know how to treat it. We shouldn't be seeing this anymore. So how many are we actually? So if we're seeing globally around the world, there's around 2.3 million in 2020 breast cancer new diagnoses in 1 year, yeah? And then if we see how many died from breast cancer, it's 685. So it's more than 500,000 dying every year from breast cancer. How many in ASEAN countries? In ASEAN countries, it's 159,000 cases every year, and then 59,000 died from it. So a third died from breast cancer. It's too much. When we see the number of breast cancer survivors, so how many sisters do we have in the world? It's 7.8 million, and this is only people who survived or who were diagnosed with breast cancer 5 years before. If you're including everyone, 10 years, 18 years, we'll see more and more people who have been previously diagnosed with breast cancer. And then if you're seeing then in ASEAN countries alone, it's about 500,000 people. So there's really a lot of people who we can work with, communicate with, collaborate with, especially into pushing breast cancer further in the future. So why ASEAN countries is so important or so interesting? For me, it's interesting in many personal ways. But ASEAN countries is also very interesting because it's so big, it's so large. It's large in terms of geographical region, but it's also large in terms of population. You can't see this very well, but only in Indonesia there's at least 220 million people living there. It's one of the most populated countries. And then you see all the other countries. And in ASEAN as well, we have population that is as big as 220. We have also population that is as small as Timor-Leste or Brunei Darussalam, for example. That's tiny country, small, from which we can, I'm sure, learn a lot. What is so special about the ASEAN country as well is then how different each of the countries in terms of level of socioeconomic development. So this is then the colors that you see then from HDI. So this is Human Development Index. If you see then the color very dark blue, it's very, very high HDI countries. That's Singapore and then Malaysia. Is then on the top of that high HDI country, which is in blue. And then you see then countries that is also very low HDI, or then in the medium HDI country. You see Laos, Myanmar, Cambodia is then still there. You see then all variation in terms of population numbers, in terms of socioeconomic, in terms of cultures. We are similar, but there's also a lot of diversity from which we can learn from each other. Again, where are we then globally in terms of breast cancer cases? So, of course, then the number first breast cancer cases in the world are then in China. So that's the biggest then round there. Followed then by some Asia as well, and after that Europe. But then you see number 5 is then where South Asian countries are. So we are the 5th contributors of breast cancer cases. In terms of numbers of breast cancer cases, we are big globally. And then if we see number of cancer deaths, it's even worse. We are number 5 in terms of new number cases, but in terms of number deaths, we are number 3. It means there's something wrong there. How can we are 5th in number of cases, but we contributed much more in terms of deaths? There's again too much cases that at the end didn't get the right treatment and then had to die from breast cancer. So this is then how breast cancer in different parts of the world. You see then on the top USA, Japan, ASEAN, then is somewhere there. And then you see then the number of cases, for example, in Singapore, and it's lowest in Myanmar. Okay? So in Singapore, there's a lot of new number of cases, but it doesn't mean that there's a lot of number of cases. There's also a lot of number of women dying from breast cancer. If we see then below it, on the right-hand side, Malaysia actually comes first in terms of number of deaths. The number of deaths is much less than the number of new cancer cases, but still, then you start then to see how different it is. I'll pick up then Myanmar, who is then having very low new number of cases. It's 20 per 100,000. But if you see the number of deaths from Myanmar, it's close to 10. So half of the women who were diagnosed in Myanmar, they die from breast cancer. Well, then if you see Singapore, there are 60 women, and then you see only 15 or 10 died from it. 1 out of 6 died from it. It's not 1 out of 2. It's a complete big inequality if you see then in terms of survivorship. So this is then putting it a bit bigger. What is then the first cause of cancer in ASEAN countries? As you can see, almost in all countries in ASEAN is then breast cancer number first. It should bring then a lot of advocacy power in terms of discussing or bringing breast cancer forward, at least as an example, where then we have then a lot of drive as well, because then we have a lot of survivors who can do then the advocacy and bringing our voice to everybody out. In Myanmar, cervical cancer is then the number first incidence or number of cases still. If we are seeing then the causes of death, it's become a little bit different. So breast cancer then is important still in a lot of countries, so that is then the pink color there. If you see then Brunei Darussalam, the first causes of death among women there is then lung cancer. So probably there's much more smoking there. In Thailand, you see then in Cambodia as well, liver cancer, very poor prognosis cancer, and in Myanmar it is then cervical cancer. This is very, very small, but then this is then showing you a little bit where is then breast cancer going at the moment in terms of the rates. So on the top, you see then the 3 lines. It's in Japan, Korea, and China. Breast cancer incidence or diagnosis over year. The only thing that you need to see, it's all going up. So breast cancer incidence diagnosis is going up in these countries. In the lower bottom, you see then breast cancer mortality. And then you see in Japan or in Korea, it's starting to stable down. So it's very flat. And this is what you want to see. The diagnosis, earlier diagnosis is going up. So breast cancer, new cases are going up, but mortality shouldn't come up with it. People can be treated. And then this is then the data a bit from ASEAN. ASEAN has very little data, and that's what I'm going to complain about later on. Malaysia is then on the top, after that followed by Philippines. So Philippines, you see the rate of incidence, new number cases of breast cancer going up a lot. And then you see then on the bottom in terms of the mortality. I think this is Thailand, if I'm not wrong. It's going up too much. It shouldn't be going up like that. Why should then breast cancer mortality going up? Philippines is then also there. It's not, it's going up a little bit, and then you see then somewhere then it's a bit more stable. This is then other country in South Central Asia. You see India, how low the rate, and then a lot of the mortality is some stable, some is then going up. You see this very little, this is stage of breast cancer at diagnosis. So you see the countries again, and then you see then 4 countries for which we have data. The lowest part there where you see then green and blue, that's the data from Singapore. 90% of breast cancer diagnosis in Singapore is then patients who are not diagnosed with metastasis. So 90% were diagnosed with stage 1, 2, and 3. And then if you see in some of the other countries, in the Philippines, in Malaysia, and then in Thailand, you see around 80-85% diagnosed with then stage 1, 2, or 3. So not bad in a way. But then what is then really obvious? So Vietnam is on the top there. A lot of the line is red. And that means that there's just no data. Staging data are rarely collected by a lot of people. And then if you don't have staging data, how do you know whether you're doing well or not? What is then the status of the country at that moment? Most of the patients are not staged, at least not in the data. And then if you see then, for example, Philippines, 25% of the data that I have there are not staged. And this is from the capital city of Manila. How do I know what is then how people, breast cancer patient doing in the outside, in the rural part of Philippines? And that's true as well for Thailand and Malaysia. So this brings me then to the next, we're then going to see the data availability. So I showed you now data. There's a lot of, it looks like everywhere there's good data. We know the numbers. We don't need to do anything anymore. And this is how the data status is then doing at the moment. So countries where then it's blue, there is then some high quality data to get then cancer incidence, number of new cancer cases. And then the where then it's yellow, there's some kind of a data, but the data is not very good at all. And then the poor, it's very, very bad data. Okay? So let's see Singapore. 73% of the people are covered by the data. So I know status of breast cancer here for 73% of the population. And this is, from Indonesia, I know Singapore is then the richest part of, this is the best part of the country. If we see then, for example, for Thailand is the next best one, only 29% of the whole Thailand where we have some kind of an information. So 30%, a third of the population. What's happening with the rest, we don't know. If we see the Philippines here, only 17%. So that's also only for Manila and Rizal. It's a very small part of the country. The rest, again, we have no idea. And then if we are seeing the rest of the country, it gets worse. Vietnam, we know about 10% of the people. And then the rest of it, we know then very little. And then this is then for some part of Laos where we then have a bit of data. This is data on mortality. Do we know who dies from what cancer or what kind of cancer? All the gray part, no data whatsoever. So whatever data that I gave you just now actually is based on countries, neighboring country. Indonesia is based on estimates from Malaysia. I mean, we are the same, but we are different. You have then some data from Malaysia and Thailand, and then the Philippines, we have then a bit of data as well. But the data is not blue, meaning then the data is a really poor quality data. So that is said. What will we see then in the future? what we will then see in terms of the part that I want to really then say really a lot, I'll go immediately then below. There's a data gap. We don't have enough information. I can give you them presentations. They were all estimates. We really, if I can have any wish of any advocacy, please try then to collect more data so then we know how we are doing and how we are progressing as well in terms of the fight against breast cancer and other cancer as well. And breast cancer is an important disease, so it's not something that you want to put aside. It's important for the person, but it's important as well economically. I'm sure it has a big economic impact, and not only economic impact, it has also a lot of social impact in the community. And ASEAN is diverse, so let's use it to learn. It's diverse in terms of the causes of cancer, it's diverse in terms of the policies, so then you can learn from each other. There's a lot of diversity as well in terms of healthcare. So we can learn what is working there, what is not working here, how can we make it work in our country or our communities. And again, please, for the data, I would be really, really happy if then someone can bring it forward. We need then more data, especially in Asian countries, because we need those data then to see whether we can then move forward and how we can move forward. Thank you so much. And then if there's any questions, I'll be happy to answer.
Thank you so much, Isabelle, for sharing the data with us. Would you mind if we take in some questions? I would also request the ones who are with us online to please send us your question. Just post your questions on the chat button, on the chat button on the bottom part of your screens, and then we will read your questions here. Meanwhile, given the numbers that you gave us, Isabelle, what can you say about the availability and affordability of cancer treatments in the ASEAN region?
That's a difficult one. It's not only cancer treatment, but also cancer diagnosis, I would argue. And then thinking of coming from a WHO perspective, there's a lot of push towards now kind of universal health coverage, cancer laws and so on to improve access to diagnosis, early detection and screening and treatment. Again, I would argue it's towards the data. Of course, if we're seeing a lot of, I'm collecting a lot of data online, but also we're doing a lot of discussion with people. I often see a very positive information, which is good. There are progress, but I think there's not enough. I don't think that there is enough good progress yet while we have a lot of the progress. I think the data are often used to cover what is not there. And then I often hear, okay, there is, really, if you see then WHO data, you see that screening is happening in every country in ASEAN countries. Coming from ASEAN countries, I know it's not true. And then so this kind of information, it would be really good if it brought forward in a much more transparent way.
Well, we remain hopeful that something gets done about this, that there gets to be more government support for the treatment of our cancer people, especially as it's already an established fact that it's not only women who get breast cancer, but men too.
Yeah. Well, and then there is a lot of stigma, no? And
Yes.
cultures. So it's the government is important, but coming down from a lot of people, it's also important, because if I hear my own family, there's with cancer, there's so much stigma that they don't want to go forward, no? Even if...
But I also think, though, one of the reasons why there have been great strides in the treatment of breast cancer women is because it's the women warriors who are pushing it forward.
Yeah. Yeah.
You know? So that's why there's been progress there. But it's progress that not only the warriors can take on themselves, government has got to come
Both, yeah, I agree completely.
yes. And then, now on another issue, would you say that environment has a lot to do with the proliferation of breast cancer?
So there's a lot of discussion in terms of the causes of breast cancer. I would say the most important causes are still the causes that we know. And then I think while research should be moving forward in finding new causes of breast cancer, we should be fighting of the causes that we know and then work on that. Like you said, little step, but a step forward. We have a lot of information what causes cancer in terms of nutrition, healthy habits, and there's a lot, again, that governments can actually do and help the population, right? And then while then the research find out new environmental causes, which I find it very complicated, we can then move forward and tackling things that we know and how we know how to tackle them effectively.
I raised that question because there was a few years back, I was having my ultrasound. And then there was a woman beside me who was asking me some questions. And then as I was answering, she said, she revealed that she had breast cancer, but she said she wasn't worried about herself, but about her 17-year-old daughter.
Yeah.
The two of them were diagnosed with breast cancer.
Yeah.
And the young girl hadn't been told yet. She was just playing a video game on her phone. And then I asked the mother where they live, because I wanted to get to know if there was an environmental reason, like radioactive whatever in their area. I asked for her number, and then I said, usually in such a case, there's a possibility of raising funds for the treatment, mother and daughter, and it will strike a sympathetic chord with people who will want to donate, except that the woman changed her phone number. And then after a while, she sent word that she and her daughter had just decided to go back to the countryside to just wait and die there. And that was really, really, really sad.
I agree.
Yeah.
But the other part is genetic, no? Especially when a family and then younger people had cancer, there's genetic checks would be also good.
That is right. Now, do we have questions from our online? But from the audience.
I'm Feli Atienza of Cebu. ICANSERVE Cebu. My question is, who is in charge of the gathering of data of the cancer survivors who are dead? Because as I can see, it's very low.
So yeah, that's why I also showed the mortality data, because how we know whether there are survivors or not, we link the data with the mortality data. So where there are no mortality data, we don't know whether then the survivors are survivors or not. So then that's the big problem. I'm sure it must be bigger than that because the data is not there. They are just estimations at the end.
So how can we correct that? Do you have to tell our doctors, the hospitals?
So you can do it in many ways. First, it would be nice if the doctors would be then making better notes, so then the people can take the data. Often the doctors think that notes are for themselves. Yeah. So having better notes of mortality notes and cancer notes would be amazing. The second part is there's a lot of discussion, just picking up the Philippines now, there's a lot of discussion about data privacy. A lot of hospitals and governmental agencies are not willing to give their data anymore for research, for a lot of different reasons, and using data privacy as one of, an excuse not to give that data. In a lot of countries, what happened now, patients ask governments or ask research institutions We want our data to be used for research. We want our data to be used for these informations. And that has bring a lot of strong movement saying, okay, now the data can be used. Those are some of examples, for example, but just, yeah, I went to the registry this morning in Rizal. They have a lot of problem getting data from the municipality for the mortality, from some hospital who are not giving those data. So teaching or getting the government, the Ministry of Health to say they have to give this data to those registry where they are collected would be an amazing step.
Okay, thank you.
Okay, we have this is going to be our last question for Isabelle. This is from Diana and question online. Are there any studies on the correlation between breast cancer and the proximity of cell towers?
Of what tower?
Cell towers for
Telephone.
yeah.
So there's a lot of studies at the moment that are ongoing about telephones, and then those are then magnetic radiation that comes from the telephone. A lot of the studies that are going today is then relating it to brain cancer rather than to breast cancer. And even then, the evidence is very, very weak or hardly any. They're doing more and more studies on it. So then in terms of breast cancer, the evidence saying the relationship is none or otherwise very, very weak. I don't think there's any.
Well, on that note, thank you very much, Isabelle, for sharing with us everything about the ASEAN regional situation. And, okay, after all that's been said and done for this portion, we know, everyone who is here, everyone who's watching online, that we in Southeast Asia will stand together in this journey, in this walk, to finally and someday defeat breast cancer. You know, I think of a breast cancer patient pretty much like a soldier. Soldiers don't die, they just fade away. And so will we, because each time we speak out and get involved in events like this, we are contributing something to the eventual defeat of breast cancer. Thank you very much, Isabelle. Now for our symposium, we are going to have our breakout rooms. If you have chosen which room to enter, please proceed to the breakout rooms now. And again, thank you, everyone. I am Bibeth Orteza. It was an honor to have shared this time and space with you.